Bismillahirrahmanirrahim. Quote of the day. The moment you stop treating people like people, that's the moment you lose humanity. Today, the topic of my presentation is hospital management, and I am presenting it under supervision of my professor, Dr. Sarah Afzal. Learning outlines of my presentation will be introduction, classification of hospitals, function of hospital, management of hospitals, central sterile service department, hospital accreditation, and recent advances in the end. Learning outcomes. In the end of this presentation, participants would be able to describe the classification of hospital management and hospital accreditation. Introduction. Hospital is an integral part of social and medical organization. Its function is to provide complete healthcare, both curative and preventive. Its outpatient service reach to the family and its home environment. It is an Italian word derived from the hospitality meaning to be guest. It is represented by staff and serpent. Staff for patient and serpent means to caring of. In US, first hospital was in the Pennsylvania Hospital, founded in Philadelphia in 1975, and in Lahore, Mayo Hospital is the oldest hospital. Factors responsible for hospital development. These are advancement in medical sciences, development of professional nursing, advancement in medical education, contribution by industrialists, and support by health insurance, and the last role of government. Classification of hospitals. This can be done depending on the type of services, number of beds, ownership, duration of stay. So here is the classification on the basis of type of services. It can be classified as general hospitals and special hospitals. In general hospital, all type of services are provided in the same hospital. For example, Mayo Hospital, Jinnah Hospital. And in special hospital, these type of hospitals deal with specific category. For example, Children Hospital, Punjab Institute of Cardiology, and Mole Hospital. Now, the classification according to number of beds. First is regional teaching hospitals. It consists of more than 600 beds. It is affiliated with medical colleges, for example, Mayo Hospital. Then comes district hospitals. It consists of 100 to 600 bed hospital, and it provides 15 specialities. For example is Civil Hospital of Faisalabad, Sheikhupura, or Kasur. Then comes rural hospital. It consists of 20 to 100 beds. It provides medical, surgical, and ops care. For example, Munawar Rural Health Center. Then comes a classification on basis of ownership. It is classified as public hospitals and private hospitals. Public hospitals are owned by government or autonomous body, and private hospitals are owned by private or entrepreneur. And this is a classification depending on the duration of stay. It is classified as long duration hospitals and short duration hospitals. Long duration hospitals there is stay for more than 30 days, for example orthopedic hospitals, and in short duration hospital stay is usually less than 30 days, for example eye hospitals. Function of hospitals. These are curative, preventive, and promotive care, domiciliary care, research and training, accident and emergency services, disaster management, physiotherapy, diagnostic services, geriatric services, and medical record keeping. Hospital administration. This term covers large number of activities which may categorize as preparation of hospital legislation, planning of hospital as a whole, and establishment of architectural control and standard. Second is application of hospital legislation and social assistance provided by authorities responsible for hospital services. And third is daily running of hospital by administrative staff concerned with personal, finance, and technical services. Role of administration. There is planning for the future while managing present. ability to produce and accept new and creative ideas, ability to coordinate, bringing harmony and collaboration, ability to analyze, synthesize, and integrate diverse information, sense of equity, fairness, and social justice, knowledge, skills, and experience. Then comes hospital management. It enables patient, doctor, nurses, teams to do their work as easily, efficiently, and economically and develop caring environment in the hospital. It consists of delegation of authority, homogeneous assignment, span of control, and unity to command. Function of management. These are planning, staffing, organizing, directing, and controlling. Elements of management are personal management, financial management, material management, and time management. And we are going to discuss each one by one. Personal management. The function of caring staff in the organization is known as personal management. It consists of human resource planning, recruitment, and selection. Now, what is human resource planning? This is information decision-making process designed to ensure that enough competent people with appropriate skills are available to perform jobs where and when needed. Then comes recruitment and selection. The aim of recruitment is to ensure that the organization demand for manpower that is met by attracting potential employees in a cost-effective and timely manner. These are the two main steps in recruitment: job analysis and attracting the application. Job analysis consists of job specification and job description. And job specification is knowledge, skills, and personal characteristics required for the job holder to carry out job in acceptable standard. And job description is information about the whole task performed during duties. And attracting the application is done by advertisement, evaluating applicants, selection, and placement. Then comes the second, financial management. The main thing is budget. It is the formal financial statement of policies, plans, and goals that are designed to ensure that actions are taken within boundaries. These are of two types: development budget and non-development budget. Development budget is used for new process, while non-development budget is used for salaries and daily expenditures. Monitoring of budget is done through monthly statement, excess statement, accounting, and auditing. Then comes material management. The supply of right thing at the right place, at the right time, and at right cost. It comes under material management. Then comes time management. Time management is fundamental for adequate job performance. Hospital management should be able to control and usefully consume the time of his subordinates for the welfare of patients. Now, other topic is Central Sterile Service Department. It is separate department within the hospital which receive, store, processes, distributes, controls professional supplies and equipments from all departments of hospitals for the care and safety of patients. Now, its functions are to provide sterilized material, contributing to a reduction in the incidence of hospital-acquired infection, to avoid duplication of costly equipment, to maintain record of effectiveness of cleaning, disinfection, and sterilization process, to maintain supply of equipment, to maintain safe environment for the patients. Now, services in hospitals that are given other than quality care to patients are housekeeping, kitchen, medical store, laundry, library, security. Now, hospital accreditation. A self-assessment and external peer assessment process used by healthcare organizations to accurately assess their level of performance in relation to established standards and to implement ways to continuously improve. It is mainly aimed for the reduction of medical error, which is a key role of the accreditation process, and hospital accreditation is therefore one component in the maintenance of patient safety. Then comes International Organization for Standardization. This organization is an independent, non-governmental organization the members of which are the Standards Organization of 165 member countries. Now, ISO certification is done for qualifications of doctors and assistants, inventory control, waste management, sanitation, maintenance of all equipment and its records, fire detection and fire prevention, rodent and pest control, adequate open space and parking space, medical stores, security system, waiting areas, and toilets. Now, why do we need ISO standards for health? These are for to assess to health services, quality care, safe medical practices and equipment, cost-effective solutions. These all have become the expected norms of today's society. So ISO works through its network of national members to bring together the foremost international expertise and disseminate it globally. ISO standards for health help ensure that individuals and communities receive the quality of care they deserve. By implementing ISO standards, organizations and companies make a proactive commitment to the principles of quality, transparency, accountability, and safety. The ISO standards make it easier to compare health services, exchange information, aggregate data, and safeguard the privacy of an individual's health. And more than 1,400 ISO health standards help to ensure these aspirants are achieved. Good health and well-being are one of the UN's Sustainable Development Goals, the UN's new roadmap, as we have already discussed in previous presentations, which is aimed to improve people's life by 2030. Now, who benefits from ISO standards for health? These are industry, regulators, and consumers. For industry, ISO health standards ensure consistency. Healthcare providers, national governments, and manufacturers benefit from not having to comply with multiple specifications and requirements for different markets. Regulators can rely on trusted, internationally harmonized solutions which are continually reviewed and improved to provide the technical foundation for market-friendly regulations that meet citizen expectations. And how consumers are benefit from ISO standards. ISO standards safeguard consumer interests by ensuring good quality care and safe and reliable products and services. Joint Commission International. Joint Commission International works to improve patient safety and quality of healthcare in the international community by offering education, publications, advisory services, and international accreditation and certification. Now, how can JCI accreditation help? It has the two areas it works on, that maintaining standards, evidence-based, comprehensive, integrated, and others by carrying out surveys. That is, it evaluates policies and procedures and assess their implementation. It identifies risk areas, it serves as benchmark, standardized processes, develop critical thinking, create learning culture. And by increasing standardization, there is reduced variation and decreased risk, and we have improved quality and patient safety. Provincial healthcare commissions. Health regulatory body that regulate the hospitals, clinicals, laboratory, and other health centers. It is responsible for developing and enforcing minimum service delivery standards at all levels of healthcare to improve the quality of healthcare services and clinical governance. All healthcare establishments are required to implement minimum service delivery standards to acquire a license to deliver healthcare services. MSDs include minimum package of services, standards of lab care, and mandatory requirement specification that must be complied with and are vital to ensure the delivery of these services. These are the snapshots of website of Provincial Healthcare Commission, which including Punjab Healthcare Commission, Sindh Healthcare Commissions. Now, what is minimum service delivery standards? These define a set of the benchmarks for minimum level of mandatory services that a healthcare establishment is responsible to achieve and patients have a right to expect. The standards prescribed in the MSDs cover the following functional areas for assuring quality healthcare services delivery. These are assessment and continuity of care, care of patients, management of medication, patient right and education, hospital infection control, continuous quality improvement, responsibilities of management, facility management and safety, human resource management, and information management system. Now coming to recent updates. This is a review article titled as Accreditation and Healthcare Quality Assurance in Pakistan. According to it, Pakistan has a well-established healthcare system with 70% healthcare needs catered by private health sector. The unregulated and unchecked expansion of private sector has resulted in quackery and compromised quality of care. Pakistan has a number of regulatory bodies responsible for ensuring quality in healthcare through accreditation and defined standards. Regulatory bodies are in place for registering different cadres of healthcare professionals, policies, and mechanisms. Quality assurance should be incorporated into national health policies, programs, and strategies. This is another article, Joint Commission International Accreditation, a breakthrough in Pakistan. According to it, there are 4 hospitals that are JCI accredited in Pakistan are Aga Khan University Hospital, Karachi, Shifa International Hospitals, Islamabad, Shaukat Khanam Memorial Cancer Hospital and Research Center, Lahore, and Shaukat Khanam Memorial Cancer Hospital and Research Center, Peshawar. In our country, it is the need of ours to improve quality of medical services and patient satisfaction in both public and private sector hospitals. Through the quality of medical services is improving in private hospitals, but they are not cost effective considering the fact that most people in our country are unable to afford them. Now, these are the 6 international patient safety goals. Goal 1 is identify patient correctly. Second is improve effective communication. Third is improve the safety of high alert medications. Fourth is ensure correct site, correct procedure, correct patient surgery. Fifth is reduce the risk of healthcare associated infections. And goal 6 is to reduce the risk of patient harm resulting from falls. But recently in 2021, 7 national patient safety goals have been proposed by JCI for hospitals to be focused on. First is identify patient correctly. Second is improve staff communication. Third is use medicine safely. Fourth is use alarm safely. That is make improvements to medical equipment alarms so that the key personnel can hear and respond to them quickly. Fifth is prevent infection. It is employers should follow the hand cleaning guidelines from the CDC or WHO hospital, and hospital administration should set goals for hand cleaning and infection control and seek continuous improvement in this area. 6 is identify patient safety, and 7 is prevent mistakes in surgery. This is in another article on electronic media medical records implementation in hospital, and this is in review on investigation of individual and organizational determinants. According to it, electronic medical records are key factors for improving healthcare quality, safety, decreasing cost, and optimizing process. However, this study combines institutional and individual factors that are inhibiting electronic medical records implementation in hospitals. Now coming to MCQs. MCQ number 1. A hospital wants to get international registration for achieving quality control and minimizing errors. Which of the following international organization registers hospital meeting international criteria? Joint Commission International, Punjab Healthcare Commission, Sindh Healthcare Commission, Medicare Center.
A.
Yes, A is the right answer. MCQ number 2. Centralization principle of management science has brought the existence of CSSD in hospitals. The significance is to bring advancement in medical sciences, to help doctors to develop leadership qualities, to bring efficiency, economy in the centralization of sterilization of surgical equipment, one location for use all over hospitals, to help non-medical staff to learn administrative skills.
C.
Yes, C is the right answer. MCQ number 3. Human Resource Department monitoring the financial outcome of the hospital after completion of 1 year. Which aspect is covering in this scenario? Auditing, assessing, appraising, checking. Auditing is the right option, A. MCQ number 4. In tertiary care hospitals, some employees are appointed and given information about scope, duties, and responsibility of particular job. In this scenario, which aspect of job is covered? Job description, job variation, job specification. Sorry, I have repeated this option. Which one of these is the right option?
Job description.
Yes, job description A is the right option. MCQ number 5. In the XYZ city, the government has approved the construction of hospitals in which the number of beds is 100 to 500. In which category this hospital is falling? Tertiary care hospital, teaching hospital, district hospital, basic health unit. It's a very easy MCQ. The right option is
Tertiary
district
care.
hospital C. MCQ number 6. According to June 2021, Ministry of Science and Technology of Pakistan gave the certification number 5257-2013 for the standardization of hospital. This process is known as hospital accreditation, hospital certification, green building certificate, and global agriculture process. The right option is A, hospital accreditation. MCQ number 7. A health practitioner wants to open a clinic in rural area of Punjab. Which of the following licensing is compulsory while opening a medical center in Punjab? International Standardization Organization, Joint Commission International, Provincial Healthcare Commission, Pakistan Medical Council.
C.
No, right option is A, International Standard Organization. MCQ number 8. Administration of Tertiary Care Hospital decided to build new block for the expansion of hospital. Which type of budget used for this purpose by the Financial Department of Hospital? Developmental budget, non-developmental budget, budget of organization, donations from various organizations.
A.
Yes, A is the right option. MCQ number 9. Gynecologist performs C-section in the OT and the instruments being delivered in OT absolutely correct and on right time. In which category of management it is falling? Personal management, financial management, time management, material management.
Material management.
Yes, right option is D, material management. MCQ number 10. In XYZ hospital, there is biometric system for the attendance of employees and explanation call for the employees who are not following duty hours. This type of management is known as personal management, time management, finance management, material management.
A.
No, right option is B,
Time
time
management.
management. Yes. This is the key of MCQs. Thank you.
Thank you very much, Dr. Meha. Very nice presentation, and especially what you have talked about the healthcare and her standardization of healthcare, and how this is very important, because this was the concept in establishing the Punjab Healthcare Commission, and later on we have seen that other provinces have also established their healthcare commissions. So one of a very important point is to provide the quality services and healthcare services. Very nice presentation, and as there are no questions and comments in the chat box, so we are going to stop here and see you next time, inshallah. Allah Hafiz.
Allah Hafiz, thank you.